Janet was 13 years old when her parents began to aggressively argue. As an only child, Janet had no one to empathize with, so to cope with her family issues, she turned to food. Janet would often eat enormous amounts of food all at once, then force herself to purge shortly thereafter. When she turned 16, her parents finally got divorced. At this point in her life, Janet's disease hit hard. She turned to bulimia for comfort, and it gradually became an obsession. Bulimia was the only thing in her life that gave Janet a sense of control. Bulimia became Janet's support blanket. It was her best friend. It was the part of her life, the only life she knew. When others in school started to notice changes in Janet, they teased her about her looks. She became very concerned with her image. With this concern and a broken home, Janet began to feel extremely overwhelmed. Self-image is the idea one has of one's abilities, appearance, and personality. In today's world, society plays a colossal role in how one sees themselves. Our concern with appearance has become drastically more obvious throughout the years. Society has created an ideal vision of how everyone should look, act, and dress. This ideal vision is almost unattainable. It puts stress on everyone to transform themselves to fit that ideal vision. Most of those who feel the need to fix themselves to appeal more to this ideal vision are between the ages of 10 to 24 years old. They sink to drastic measures which lead to mental disease, such as eating disorders. Around 24 million people of both genders in the United States suffer from eating disorders. Not only do victims have to deal with expulsion from society, but many may also have internal issues that push them towards eating disorders. In fact, many people turn to this disease to cope with low self-esteem and family issues on top of the social norms, including Janet. Often victims use food to deal with emotional issues. With all the pressure put on victims from society and how they choose to deal with social issues, family members have an important role in victims' lives. It is vital that awareness is raised so parents, family members, and friends know it is not the victims, like Janet's, fault when suffering from anorexia nervosa, bulimia, and binge eating.
Anorexia nervosa, known as anorexia, is an eating disorder where people starve themselves to lose weight. They starve themselves to unhealthy levels, but still have an intense fear of weight gain. The most common victims of this disorder are teenage girls, and is the most associated with body image. It is created by social pressures to be thin, which develops into an obsession. There are many symptoms and signs of a person with anorexia. Nina Bahadur discusses the signs and symptoms in her article in the Huffington Post. The first and most noticeable is their intense fear of weight gain. They will take extreme and dramatic measures to limit food intake. Victims show many signs in mealtime situations, such as cutting food into small pieces and not actually eating, going to the bathroom right after meals, refusing to eat around other people, using laxatives and other pills, and many more. It is also noticeable to see their physical bodies and minds literally deteriorating. Some signs are blotchy yellow skin, fine hair, confused and slow thinking, weak and frail voice, constantly feeling cold, and the loss of bone and muscle strength. The lack of nutrition in their bodies starts to break down the basic functions needed for survival. However, with all these physical symptoms, the victim continues to harm themselves willingly because when they lose the weight, their brain gives off positive emotions. As Bahadur states, sufferers feel pride and other positive emotions, which may prevent them from wanting to get better. The thinner they get, the happier they feel with what they are doing. Millions of people suffer worldwide from anorexia, and only 10% receive any sort of counseling or specialized treatment. As a victim's brain convinces itself that it is doing the right thing, the effects of anorexia become an exponential downward spiral unless it is confronted the correct way.
The chemicals in a teen's brain clash for their appetite, emotions, and self-image. Bulimia nervosa is a common eating disorder not commonly found in men, but mainly in teenage females. Bulimia is more common within teens who have a family history of obesity, a family history of another eating disorder, or personal history of mood disorders, such as depression, anxiety, or bipolar. Teens such as Janet eat more than they should, or bigger amounts in a shorter period of time than needed. Later on, they purge or use other methods such as laxatives to make up for the overeating. Neither procedure is healthy, nor allows the body to accept the nutrients to ensure an ongoing life. According to recent studies, pediatric advisor Phyllis Cooper believes bulimia causes an imbalance of minerals in your body that can lead to an irregular heartbeat and possibly heart failure and death. But how do you spot someone who's bulimic? when they make frequent trips to the bathroom, especially after a meal, or when they exercise heavily after eating. Keep an eye out. They might have swollen cheeks from excessive vomiting, or even scars on their fingers from constant purging. Someone who's bulimic possibly takes advantage of drugs and alcohol as well.
Binge eating is defined as frequent and uncontrolled eating for long periods of time during the day, where a person consumes more than 2,000 calories, which is the normal intake for a person in one day. During this time, unlike bulimic people, binge eaters do not try to purge the food from their bodies, they simply eat and gain weight. According to Jane Brody in the New York Times, 1 in every 35 adults have a binge eating disorder. Studies show that binge eating is the most common eating disorder, coming in 2.8% of the population over anorexia and bulimia. Binge eaters tend to feel ashamed of what they do and try to hide it from everyone. During binge eating, the victim becomes somewhat obsessed with eating. The person eats until it's finished. Binge eating comes from the frontal lobe of the brain, where impulse is. Studies show that when people have any form of stress, they tend to want to do impulsive things. Some people eat. People binge eat from many things, such as stress, sadness, boredom, and worry. This may lead to a great increase in weight, along with a greater increase in risk of diabetes, high blood pressure, gallbladder disease, heart disease, and even certain types of cancer. Some people would eat up to 3,000 calories in one sitting. It gets out of hand. You can't stop. Scientists have been doing studies on groups of people, and studies show that binge eating should be included in the psychiatric diagnosis since it's like bulimia and anorexia. If the disorder becomes official, it may be included in a patient's insurance under weight control treatment.
Contrary to many people's beliefs, eating disorders are actually a mental illness. It is a pain that dwells from within and comes out in the form of an eating disorder. With the highest mortality rate of any mental disorder, it is a serious problem that needs to be understood. Friends and family's initial reactions to deal with the issue is to say, "Control yourself," or "Why can't you just stop?" Unfortunately, the problem is more complex than they initially thought. Amy Liu discusses in her article, "What Causes Eating Disorders" in the Huffington Post, that eating disorders come from a combination of genetics and environmental factors. As she states, the first thing to keep in mind is that eating disorders do not have a single cause. Most cases show the victims suffer from depression and family issues. Many people use eating disorders as a way to have control of their life. It is the only thing they can hold on to in their time of despair. Media and peers can put social pressures on victims to look a certain way. Combined with depression, this leads to an obsession to achieve an over-exaggerated and unrealistic body image. So whether it's depression, stress, family, friends, teachers, magazines, or social media, victims of eating disorders suffer from a pain within that is difficult for others to understand. As a result, it is hard for the people trying to help them to understand what is wrong, and often go about addressing the problem in a very unbeneficial way. In order to go about treating a person with an eating disorder, you must specialize your approach to the victim.
Just like the patient and disorder differ from case to case, the start of the disorder is not all identical. Some may start off as dieting, others can overexercise, and in some cases, minimizing the amount of calories may also be the beginning to a serious problem. Many of the patients being treated have stated that the disorder is their friend, something that they can control in their world that seems like everything and everyone is against them. Of course, in some cases, it can be from the household that the problem started. A simple comment on a person's appearance can change the way they view themselves. Not all of the suffering victims of eating disorders have their friends and family to blame. Their decision to vomit or overeat or starve can be caused by some other factor, an internal desire to be someone they see on a street or a magazine cover. In these cases, family and friends can do a great deal to help. Not only is there a specialist for each kind of eating disorder, but there are many kinds of treatments, such as individual or group therapy, medications, or retreats that will help with the various cases. It all depends on the severity. According to Treating Eating Disorders and Paying for It by Leslie Alderman, the hospitalization of people with eating disorders increased in 18% between 1999 till 2006. Alderman's research indicates that the steepest rise was among children under the age of 12. This should alert parents to be very cautious with everything happening to their children. Though the word is spreading throughout the nation of these vicious disorders eating away at our youth's minds, not all schools have implemented a program to inform both students and their parents about these disorders. Once a person is certain a loved one has an eating disorder, they should know how to approach them, know what to say and what to avoid saying. Blaming and focusing on how the person should change will not be helpful. Focusing on the feelings of the person, letting them know how much others care for them, promotes the person's self-esteem and lets them feel safe. Approaching them the right way can mean the difference between recuperation and the disorder becoming more severe. The longer the person suffers from a disorder, the longer it will take for the body to recuperate. In Janet's case, she started in her early teen years, when it is most common. It is vitally important to seek professional help at the first sign of the disorder. Depending on the symptoms, issues, and strengths will determine the severity and will also determine the most effective treatment. The goal of each treatment is to promote a healthy balance between nutritious food consumption, exercise needs, and to teach them ways of achieving the desired result in a consecutive manner, not all at once. Just like every case is not identical, every treatment differs from one to another, but they can all have a combination of therapy, nutritional counseling, and group support. In more severe cases, the use of residential treatment or hospitalization may be necessary. Parents, don't wait until it's too late to treat a loved one with an eating disorder. Get educated on how to find the first signs. Janet was diagnosed and treated on time. Don't let your loved one continue in this harmful path.